The World Health Organization, or WHO, is likely to release its recommendations on the possible shortening of isolation and quarantine periods. WHO representative to the Philippines, Dr. Abeyansinghe, says they are looking at global experiences, noting that many countries have reduced their isolation and quarantine durations. The recommendations will be based on several factors, including vaccination status and predominance of COVID-19 variants.
We will be sharing with governments some recommendations on taking a risk-based approach to reduce the quarantine and isolation durations so that we can provide uninterrupted services to people, especially in the healthcare, recognizing that it's not only COVID-19 that healthcare workers are providing services for.
In the Philippines, those who tested positive for COVID-19 who are asymptomatic or mild to moderate cases have to undergo 10-day isolation period, both for fully vaccinated and unvaccinated, and 21 days for severe and critical cases. Quarantine for close contacts is 7 days for fully vaccinated, while 21 days for unvaccinated. Meanwhile, isolation for asymptomatic and fully vaccinated health workers may be reduced from up to 5 days, while quarantine for close contacts may be shortened up to 0 days. However, some medical groups have opposed the new guidelines for shortened isolation and quarantine period for healthcare workers, as they express concern on its dangers to both health workers and patients. The WHO notes the difference of scientific evidence and policy decisions, emphasizing the importance of setting clear and balanced policies of nations.
There's no policy decision that's inertly wrong. If the policy decision may not respect the science, that's different. So we're positive about policy decisions that are aware of the science, listen to the science, examine the science, and then recognize and be explicit and be honest with people when your decision and policy goes beyond the science and other factors are influencing that decision.
Meanwhile, Dr. Abeyansinghe says the IHU variant first detected in France is not seen to replace the Delta and Omicron variants in terms of transmission. Currently, the variant has been classified as a variant of monitoring.
This variant has not shown a capacity to predominate in transmission, so it doesn't seem to have the capacity to be displacing Delta or Omicron. I don't think it is at this point of time warrants to be classified as a variant of concern.
The WHO assures it continues to monitor the new variant in coordination with the government of France and other nations where the IHU variant has been detected.